Hello, everyone. My name is Anna, and welcome to the third edition of our podcast. And today, we check in with Nutrition International. According to a Scaling Up Nutrition Movement study, malnutrition costs Pakistan $7.6 billion or 3% of GDP every year. The COVID-19 pandemic has brought additional and unprecedented challenges, spurring malnutrition rates to increase through the roof. Nutrition International, a global organization, has been working with the government of Pakistan to augment the digitization of oil fortification in the country. At Bioanalyt, we are proud of being part of this project and supporting the digitization of the quality assurance quality control system through iCheck Connect. For today's podcast, we have the pleasure to have Manpreet Chadha, Nutrition International Senior Technical Advisor for Food Fortification, and Zameer Haider, National Program Manager for Oil Fortification in Nutrition International Pakistan, to talk about this project. Hello to both of you, and thank you so much for accepting this invitation. Can you tell the listeners something about Nutrition International and your work on digitization?
Thank you so much, Anna, and the Bioanalyt team for having us here. Nutrition International is a global nutrition organization. We are headquartered in Canada. For 30 years, we have focused on supporting the design and delivery of low-cost, high-impact nutrition interventions for people in need. We work alongside governments as an expert ally. We combine deep technical expertise with a flexible approach, increasing impact without increasing complexities or costs. We work in over 60 countries and have on-the-ground presence through our country offices in 10 countries across Asia and Africa. To talk specifics about our work on digitization, while we have been integrating the use of digital tools and solutions in our programs for some time now, but in COVID-19, we have explored ways of making our support more meaningful in terms of our thinking, our use of digital technologies and platforms to really improve and support delivery of health and nutrition programs and services on the ground. For our digitization support for food fortification specifically, at the global level, we are collaborating with the World Health Organization to jointly explore the use of digital technologies to strengthen food fortification programs for improved nutrition outcomes. This collaboration looks at digitization for fortification from various perspectives. How digitization has been used in other sectors or other systems, what is the evidence from the use of digital tools and resources for food fortification, looking at synergies and connects and disconnects along the food value chain. At the country level, we have adapted our fortification plans and programs to integrate use of digital tools and resources in our in-country support to governments, to industry partners and other stakeholders. And Pakistan's oil fortification digitization initiative is one of these efforts, and Zameer is going to talk more about it.
Thank you, Manpreet. And turning to you, Zameer. So, Nutrition International has many projects focused on micronutrients in Pakistan. You are also currently running a project about digitizing the oil fortification program in Pakistan. So, can you please shed some light here on the project to our listeners?
Thank you, Anna, for having us for this podcast. Yes, Nutrition International has been working in Pakistan since 2001, and we have been working to improve the nutritional status of people, especially women and children. We have been working in close collaboration with national and provincial government departments and supporting nutrition interventions such as large-scale food fortification and micronutrients supplementation for women, adolescent girls, children, amongst other projects. For this podcast, my focus will be on large-scale food fortification, especially edible oil fortification, which is being implemented for over 5 years in Pakistan with support from our donors. In this current digitization project, we are embedding digital tools to improve quality assurance and quality control for oil fortification, which with support from Bill and Melinda Gates Foundation. This project is helping industry and the food regulatory bodies to institutionalize and sustain oil fortification and bringing transparency and accountability in recording and reporting data through digital devices such as iChecks and iCheck Connect software. We are working with all edible oil mills in the country and all four provincial food authorities to build their human resource and infrastructure capacities for effective implementation and enforcement. This also includes some work on building a favorable policy and enabling environment in the country to scale up and sustain fortification efforts.
But why focus on edible oil? What makes edible oil such a good vehicle for fortification and overcoming nutrition deficiency?
Uh, Edible oil is a feasible food vehicle to deliver fat-soluble micronutrients that include vitamin A and vitamin D, among others. These fat-soluble vitamins are more stable in edible oil than in any other staple food. Uh, in addition, I'd say edible oil fortification is a simple, effective, and low-cost intervention to address deficiencies of these micronutrients. So overall, the feasibility, ease, and simplicity of fortifying oil with these vitamins makes it a win-win strategy.
And what are the existing constraints for an effective regulation of food fortification in Pakistan?
So if we talk about constraints, let me share with you that unlike many other countries, oil fortification is mandatory in Pakistan, and millers are required by law to fortify their products with vitamins A and D. However, for over 50 years of mandatory legislation, the compliance to standards and adequacy of fortification remained very low due to limited enforcement capacity of the government. So Nutrition International started supporting provincial food authorities in 2017. We provided technical and financial support to strengthen their human resource, laboratory, and infrastructure capacities to improve enforcement of mandatory fortification. As a result of joint efforts, the adequacy of fortification increased from 19% in 2017 to over 90% in 2022 at formal sector mills. One of the constraints, however, is that around 28% of countries' supply is contributed by the informal sector. This oil is not properly refined. Nutrition International is working with the provincial food authorities to impose a strict ban on the sale of loose oil so that this production can be mainstreamed into formal sector production and its fortification can be ensured. Another constraint is sustainability of fortification, quality assurance, and quality control. The focus of fortification quality starts to fall through cracks at times when food authorities have to prioritize quality control for other food items, and they are busy in ensuring quality of food items other than edible oil. This is the time when oversight on oil fortification is not adequate. And digitization has the potential to ensure continuous oversight on food fortification quality assurance, which would eventually help sustain adequacy, resulting in achieving public health gains of food fortification initiatives. Yes.
And despite these constraints, how does this project contribute to reduce malnutrition, especially among women and children?
Vitamin A and vitamin D deficiencies, Anna, are a public health challenge in many countries. Pakistan also has been grappling with malnutrition at an alarming rate. According to the National Nutrition Survey of 2018, more than half the children under 5 and about 27% of women in Pakistan are deficient in vitamin A, And about 63% of children and 79% women are deficient in vitamin D. We know that oil fortified with vitamin A and vitamin D, it has the potential to improve intake and status of these micronutrients among the populations at large in any given country where it is consumed consistently, which also includes women and children. Looking at Pakistan in specific, oil fortification presents itself as a feasible intervention. Edible oil is consumed widely across the country, and over 70%, as Amir said, of all edible oil that is consumed in Pakistan is processed industrially and thus is fortifiable, which means it has the potential to be fortified. Knowing how cost effective and simple oil fortification is, we are supporting the government and industry in Pakistan to adequately fortify oil available for human consumption, contributing to addressing high prevalence of micronutrient malnutrition in the country. Thanks.
And returning to you, Zameer, you referred previously that you currently work with more than 90% of edible oil mills in this project. So, in what ways are the stakeholders involved in your digitization initiatives?
Yes, Anna, we are in fact now working with almost 100% of the edible oil mills in the country. There are 142 as of now. We are supporting all of them to ensure adequate fortification as per standards. In doing so, we are enjoying exceptional support from millers and the Millers Association, that is Pakistan Banaspati Manufacturers Association. The industry and government stakeholders consider Nutrition International as a trusted partner in food fortification and extend their support to us. We have also signed a memorandum of understanding with the Industry Association, with the National Fortification Alliance at the Ministry of National Health Services, and with provincial food authorities to formalize our partnership. On introducing digitization and innovation, we pilot tested digital tools and modern devices like iChecks to integrate those into the production and quality assurance processes at the mills so that the edible oil supplied by the mills meets national standards of fortification. We have also built capacity of millers for testing their samples for vitamin A. Uh, a group of mills was selected to participate in beta testing that is being supported to, and that group is being supported to upload their test results on a centralized database for reporting using BioAnalyte's web application, the iCheck Connect, and Nutrition International's fortification information system. This is helping in determining the level and adequacy of oil fortification at mills in a transparent way. The scale up of this initiative is planned later this year, and that will help to take course corrective actions to improve compliance to standards across the country. So we are really this project is being implemented in close collaboration with all key government and private sector stakeholders, and they are fully apprised on regular intervals on the progress we are making.
Amazing. But I believe, Zameer, that it's not all roses. So, what are the challenges of this digitization program and how has it affected scale up of oil fortification in the country?
As you know, introducing change is a lengthy process, and we are also experiencing this fact in our project. We came across a few millers that prefer paper-based record keeping over digital tools, and some of the millers resist sharing their data with government authorities due to several reasons. So for this, we are engaging with the Millers Association to expedite the scale-up process and win the support of those millers who are not extending their full support at the moment. Secondly, we found out that small-scale millers require more handholding support to be fully able to institutionalize and sustain digitization, for which a comprehensive training and engagement program is being implemented by Nutrition International. One thing that has yet to be started is integrating external quality control in our digitization initiative. For this, the planning has been done with all stakeholders, and we will now soon be initiating its implementation. Doing so will help in accessing data by the government food authorities on tests performed in the field through a centralized database for decision making, and that will help governments to take course corrective actions where required. We also anticipate that uptake of digitization could be slow at newly established food authorities, and this may prolong the process for which we are engaging with senior government officials and advocating with them for timely implementation and rollout of digital tools in Pakistan to bring transparency, efficiency, and accountability in implementing edible oil fortification and enforcing it.
What would you say that are the biggest lessons learned from this experience for food fortification as an intervention?
Uh, Food fortification programs, they suffer from a few critical issues. These include weak regulatory enforcement, lack of industry partners' capacity, among other important ones. We feel digitization has the potential to strengthen and sustain food fortification quality and compliance. Our project in Pakistan, about which Zameer is talking, it is striving to develop a country-owned digital quality assurance quality control system that enables the mills and the government authorities to bring in more transparency in reporting data and using this data and information for evidence-based decision making. However, as Zameer has mentioned, we feel there is still a lot of work to be done to fully automate and digitize the food fortification quality, both internal and external, and scale it up across the country for an impact. As we move along, we feel it is important for us as Nutrition International to capture all these lessons, experiences, these challenges that we are encountering, and the mitigation strategies that we are employing to address these bottlenecks. It will really be very important to synthesize these lessons for further use and improvement in our plans and programs. In addition, it is also important to assess the scope of digitization, adapting it along the entire food value chain, where information and data is available on production, on premix consumption, on quality assurance, quality control, coverage, what influences consumer behaviors. All of this is available to really help review and strengthen the food fortification policies and programs. At the end, we also feel another critical learning is also to bring both the global and the country level experiences and learnings together. And this approach really forms an important part of Nutrition International's evidence to action approach. And we apply it to all our plans and programs and see how we can strengthen both evidence generation that could further guide action on the ground, and how learnings from that action through implementation research and other initiatives can really identify additional evidence generation needs that we can then build evidence on. So that's the evidence to action approach that we follow, and we feel that it's important to bring that approach to digitization also. Thanks.
And do you believe that through this intervention, Pakistan will be one step closer of eradicating the deficiency of essential micronutrients in the country?
Yes, Anna, we believe that digitization has the potential to strengthen and sustain food fortification and its compliance. And introduction of these modern tools and technologies in Pakistan is also helping in improving the adequacy of fortification. This will definitely improve the availability and consumption of fortified oil, resulting in improvement of vitamin A and D intakes, which would eventually result in a reduction of these deficiencies. We also witnessed this trend in recent National Nutrition Survey of 2018, where vitamin A deficiency in women decreased from 41% in 2011 to 27% in 2018. On the basis of available data, I do believe that oil fortification is contributing to the efforts in reducing deficiencies of essential micronutrients. Over and above, the government of Pakistan and the provincial governments are also prioritizing food fortification. Recently, the food fortification legislation has been mandated in 2 provinces, and the work is ongoing in other 2. So in addition to this, food authorities are also allocating resources to make this happen and ensure implementation of food fortification projects. The industry is also gearing up to support the legislation and contribute in improving micronutrient deficiencies in the country. These efforts for sure will bring positive changes in the nutritional status of people, including reduction of these vitamins and mineral deficiencies.
Unfortunately, we are reaching the end of this podcast. So, last but not the least question, what does the future hold for Nutrition International?
Thanks for that question, Anna. I'd say we definitely have exciting times ahead. Looking at malnutrition, it's one of the most persistent obstacles to improving prosperity, improving growth, and human development. And we all need to address this challenge together. At Nutrition International, our vision is a world where everyone, everywhere is free from malnutrition and is able to reach their full potential. By 2030, Nutrition International, we intend to transform the lives of 1 billion people in need, especially women, adolescents, and children through improving their nutritional status. At Nutrition International, we believe that both digitization and leveraging social protection programs, they have a critical role to play in our fight against malnutrition. Talking about digitization, we have seen incredible growth in this area over the last decade. And this presents a tremendous potential to really strengthen and improve initiatives and outcomes, especially in low resource settings, which may have been previously unreachable. There are lessons from application of digital technology in other sectors, such as health, agriculture, education, and also in food fortification. And we really, at Nutrition International, we want to be instrumental in capturing these lessons and evidence and support food fortification policy and programming for greater impact on nutritional outcomes. So as I said, we definitely have exciting times ahead, but there's a lot that we still need to do to be able to achieve improved nutrition outcomes. Thanks.
Wow, amazing insights that were shared today in our podcast. And thank you to both of you, and also thank you to our audience for listening to another iCheck-in podcast. See you soon.